The pain following a cesarean to deliver her second child was excruciating for this woman. It was only when x-rays were taken and another operation that she discovered the doctor had left gauze, an ID bracelet and a piece of metal in her abdomen.
I'm
no longer healthy enough to care for my children and for my home. My husband had to get another job because I always need to visit doctors and hospitals for treatment. They've told me my intestines have become weaker and that I may develop cancer in the uterus.
And this woman developed gangrene following an operation to treat her obesity. Parts of the stomach were destroyed according to her medical reports. Since then, she has been fighting a lengthy legal battle.
My case has been in the court for 2 years. The patient is right in front of you. The medical malpractice is crystal clear, proved by the testimonies of several physicians and backed by medical reports and x-rays. Why is he still out there practicing medicine?
In both cases, the doctors concerned refused to comment. Medical blunders are thought to kill at least 80 people a year in Jordan. In 2009, the Ministry of Health said it had received 3,000 complaints related to alleged medical negligence. Jordan, however, is ranked #1 in primary healthcare development according to the World Health Organization. And annually, it makes more than $1 billion treating medical tourists from abroad. Jordan's hospitals and doctors have a reputation of medical excellence across the Middle East. But after scratching beneath the surface, we have found evidence of medical malpractice and negligence. The Ministry of Health says over 60% of medical blunders can be avoided. That's why it wants to introduce a medical liability law to protect patients' rights. The government wants a law that covers potential malpractice suits within a 3-month time frame. It believes such legislation will attract more international patients, even if it means some doctors leaving their profession.
Even people from outside, when they are looking at Jordan, they have a medical liability law, there will be more trust in our system. And this is very good even for our institution. The people, they have to get their rights. This is my opinion. We are talking about human rights. This is one of the main human rights because we are dealing with the human body.
But opponents believe such a law will mean higher costs for the patient, excluding the poorer from treatment.
The proposed law doesn't place a limit on how much will be paid to the patient or their families in compensation. If a mistake's going to cost me $1.5 million, then why would I stay in this profession?
There is concern among medical professionals that any liability law will inhibit the work they do. And for those patients who have suffered medical malpractice, the realization is that any form of compensation could take years. Nisreen El-Shamayleh, Al Jazeera, Amman.